Millions of Americans suffer from allergies every year. Statistics show that 1 in 5 people in the U.S. has either allergy or asthma symptoms, which makes allergies the 5th leading chronic disease in the United States among all ages, and the 3rd most common chronic disease among children under 18 years old.
Allergies is a very broad, general term that lots of people use very loosely for many different things. Some people describe seasonal hay fever, where you get the itchy eyes, the runny nose, as an allergy. And some people use allergy as, for example, when you are allergic to a bee sting and a bee stings you and you go into anaphylactic shock.
So what is allergy? Allergy is an overreaction of the human immune system to normally harmless substances in our environment known as allergens. Common allergens include pollen from trees and grasses, house dust mite, molds, pets such as cats and dogs, insects like wasps and bees, industrial and household chemicals, medicines, and foods.
The common allergies are those that people are allergic to the pollens in the air from the plants. There's also the allergens of animal fur or animal dander, which is basically the flakes of skin off of animal hides. Then the 3rd most common are usually food allergies that people are allergic to.
Food allergies, however, should not be mistaken with food intolerance that affects many people. Unlike a food allergy, food intolerance doesn't involve the human immune system. For people who have a food allergy, consuming even the tiniest amount of the food they are allergic to may trigger a serious allergic reaction. By contrast, if they are intolerant to certain foods, they can still probably eat small amounts of these foods without any reaction.
Many people have sensitivities to things that are not really allergies, they're just sensitive to them. There are people who are sensitive to wheat products but not allergic to it. And then there are people who have what they call gluten sensitivity, that they don't have the ability to metabolize the wheat. And that's not really an allergy, that's lacking an enzyme to deal with the product.
When you have allergies and your immune system overreacts to the allergens, it creates an inflammation, which, in turn, can lead to a variety of symptoms causing people a great deal of misery. The allergic symptoms may include stuffy, itchy, or runny nose, itchy eyes and ears, itching, tingling, or swelling of the lips, mouth, tongue, or throat, fever, skin rashes, congestion, coughing, sneezing, or wheezing, and others. Severe allergic reaction may result in the following symptoms: difficulty breathing, dizziness, sweating, and faintness, rapid increase in heart rate, sudden hoarseness or inability to speak, immediate and extreme facial swelling and itching, anaphylaxis, which is a sudden, severe, and potentially fatal allergic reaction. There are genetic and environmental risk factors. If one of your parents has allergies, there is a 33% chance that you will develop them too. Odds for a child with 2 allergic parents will have allergies increase to 70%. To develop allergic reactions, one must first be exposed to the specific allergen for some time to build up the allergic sensitivity, and then, once more, to trigger the allergic reaction.
Usually the previous year is when someone is new to the area, they become exposed to the different allergens in the air, and it's not until the following season that they develop an allergic response to it, such as, again, the sneezing, stuffy nose, runny nose, itchy eyes.
If you think that you have an allergy or intolerance, see your doctor, even if you think you know what is causing your symptoms. This is especially important if you have a severe reaction. Allergy testing is necessary to establish the specific allergen.
Generally speaking, there's 2 types of tests. There's a blood test that they call a RAST test. Most physicians do not use that test because they're non-specific. They really don't tell you what a person is allergic to. They kind of give you a general idea that they do have allergies. So the most reliable way is to actually go see an allergist. a physician who specializes in allergies and have them do the skin testing, where they actually put the allergen on your skin and then scratch your skin to see if you mount a response.
There are 3 general approaches to the treatment of allergies: avoidance of the allergen, medication to relieve symptoms, and immunotherapy.
What I frequently will tell my patients is, if you have environmental allergies, you have sensitivities to pollen. For example, if you go jogging outside, it's okay, go ahead and go jogging. But as soon as you get home, wash your face, wash your hands, get the pollens off of your body. Avoid high allergy times of day. Usually late afternoon and early evening are the high pollen times when the motor vehicles and people have stirred up the air. First thing in the morning is usually the best time to go out into the environment when the air is calm and the wind has not picked up the pollens off the ground.
To avoid the allergens or minimize their effect, you may also wear a pollen mask when mowing the grass or house cleaning. If you have food allergies, read and understand food labels. Keep windows and doors closed during heavy pollination seasons. Use the air conditioner in the house and car. Rid the home of indoor plants and other sources of mildew. Don't allow dander-producing animals in the house. Change feather pillows, woolen blankets, and clothing to cotton or synthetic materials. Weekly, wash sheets, mattress pads, and blankets in hot water. Use air filters and dehumidifiers.
People who have seasonal hay fever or seasonal allergies, they often do very well with just allergy pills. Antihistamines are the most common.
Common allergy medications include decongestants. Decongestants are administered via spray or orally to unclog nasal passages. Steroid nasal sprays are administered via spray to mute the inflammatory response.
Steroid medications sometimes are given under extreme circumstances, but we try to avoid those medicines because they can have bad side effects.
Antihistamines block the action of histamine, which is responsible for allergic symptoms. Short-acting antihistamines are generally available over the counter. They often relieve mild to moderate symptoms, but may cause drowsiness. Chromoglycate or related agents are administered mostly as eye drops or nasal sprays to help prevent attacks. When avoidance, environmental control measures, and medications fail to control allergy symptoms, the doctor may suggest allergy immunotherapy.
If it is something that can be treated, they will ask you if you are interested in going through the desensitization process. And that's where they inject small amounts of that serum or that allergen into your body on a regular basis to allow your body to develop an immunity to the substance.
If you think you're developing an allergy or sensitivity to food, go see a doctor. It may not be the allergen that you think.
Some people are very allergic to certain weeds and bushes. And those bushes, the genetic makeup of their pollen is very similar to certain foods like wheat. And so when they eat wheat, they have a bad reaction to it, but they're not actually allergic or sensitive to the wheat. It's the weeds. And so if you can limit the exposure to the weeds, they can tolerate wheat. Not everybody is the same. For example, during the springtime when a person has seasonal hay fever, some people don't get stuffy nose or itchy eyes. They just get very tired or they get headaches. And so it can present in many different ways. So even if you're having symptoms that you really can't explain, you ought to come in and be seen by the physician because it could be allergies, even though you aren't having the classic symptoms.
Whether you suffer from allergies or food sensitivity, you will need to visit with your doctor to determine the right course of action or medication to treat your symptoms. Getting the proper medical advice and treatment will help you enjoy more of life's pleasures.